Good afternoon, everybody. First of all, I would like to thank the PPD and Mr. Adnan and his team for inviting me for this important event. And also, I'm also thanking for the foundation, which I owe much, the Gillespie Foundation, which they support me to attend such meetings. Actually, my presentation is called the non-traditional solution. Why non-traditional solutions? We have been asked that we can introduce a non-traditional solution to solve problems of our countries, okay? So we have in Egypt a crazy increase in the population growth rate. The population growth rate reached 98,101,100, okay? So there is no imbalance in between the resources and the population crisis in Egypt. What we were planning and we were focusing on the increasing in the contraceptive use. We stayed for more than 30 years encouraging people or new married to increase the contraceptive use. But we discovered that we have a newborn each 17 seconds. It means that we have 4,950 newborn per day, which is crazy. This is our total fertility rate. It decreases actually from 1980 from 5.3 to reach in last DHS, which have been happened in Egypt in 2014. But it reached 3.5 and is maintained to 3.5 till 2017. This is the unmet need. Unmet need for family planning in Egypt. Based on our CAMPS information, it's 99.9% of women in the age of the childbearing period are aware of the means of family planning, but the percentage of use doesn't exceed 58.5%. It gives us 12.6% of women have an unmet need for family planning methods. This is our maternal mortality rate curve, which is declining and fluctuating in between 1954 till 2017. It reached finally to 43.6. This is the three curves for the neonates, infant, and under 5 years of children. It starts in 1990 by 56.5 for the under 5 years and ended by 19.5 in 2017. And regarding the infant, it starts by 40 and ends in 2017 by 15.1. The infants or the neonates, okay, the neonates starts by 9.4 and ends by 7 in 2017. This is based on surveillance which have been done by MCH in Ministry of Health and Population. This is our fertility rate and the population projections with the various total fertility rates if we have 1 children or 2 children or 3 children. And this is updated by population communication in California. Okay. We discovered that the most appropriate one is to have for the families 2 children. From this respect, we started to think how to advise and convince the newly married to have new children. If we return back here, we studied with the Ministry of Planning, or I studied with Ministry of Planning and Ministry of Finance I'd like to know, how does it cost for the third baby on the governmental sectors? So we discovered that on one born per year, per ministry, it costs as an average 3,600 pounds. In 20 years, it will be covered by the government, it will cost 72,000. If we calculated with the 30 ministries, it will cost 108,000, okay? In 20 years, it will cost the 2,160,000, which is terrible. This is maybe the study was done in 2014, but when I returned back to update the cost in the budget of Egypt in between 2017 and 2018, I discovered that each born will cost 12,000 per minister. It's an average. Okay? From this respect, the concept of small family planning or small family club raised. How? The concept is to encourage the newly engaged married and already married couples changing their attitude towards the culture of having two educated children. So by this way, we changing our implementation to focus on the attitude, to changing the attitude of the newly married, rather than to encourage only the people to increase in contraceptive use. How we can do it? The installation of a small family club concept as a non-traditional solution, it came to reality based on the recommendations analysis of the statement on population stabilization of Egypt. It was done on 2014, which has been developed in collaboration with the support of GLCP Foundation and Population Communication. It aimed at helping Egypt to achieve its population stabilization by the year 2030. The ultimate goal, to improve the life, health style, and economic status of Egyptian peoples. Save the extra expenditures of billions by the government of Egypt for the third born infant, because we multiplied the cost of one by the daily thousands. Promote and achieve the population stabilization and development sustainability. What is the outcome of small family club as a concept? This program will counteract the unmet need pregnancy, increase of maternal and infant mortality rates, burden of overpopulation versus economic development and illiteracy and poverty. Because we put at this item two educated children. What it means after that, why we focus on that. It will also increase contraceptive methods use by indirect way. Because if anyone wants to be a member of the small family club, okay, she will come by her own without any enforce. So it will increase contraceptive methods used by indirect way, helps couples acquiring a new attitude of healthy lifestyle and family planning under the umbrella of human rights. We are not enforcing anyone to come, but the couples should decide when they would like to deliver and when they would like to have a baby and how many. We're introducing something to attract those people. Tangible benefits and in-kind participation benefits or support.
Dr. Refaat, please conclude. Your time is up, please.
How much? How many minutes?
it's past your time, so we are giving you
passed?
2 additional minutes.
So I'll go.
No, we'll give you 2 additional minutes.
I'll go by fast. Tangible benefits, assuming that we can give the women at the end of a childbearing period and has to educate the children, per se we can give her 50,000 Egyptian pounds as an investment deposit. But the in-kind participation that they can select one only benefit from any one of the organizations or governmental organizations. We have 30 organizations, and I developed an assessment for each ministry. I will show you finally. The concept of having 2 children has been supported and taken into consideration by His Excellency Mr. President Al-Sisi. He gave a great support for implementation. Policymakers, Parliament of Egypt, His Excellency Prime Minister, stakeholders, chairman of NGOs Union, governmental sectors, ministers of Health, Ministry of Social Solidarity, Ministry of Planning, and the National Population Council, non-governmental sectors, with the community leaders, international organizations like UNFPA. Based on that, the commitment of Egypt, or family planning, with the Family Planning 2020 Global, the government of Egypt pledged to reduce unmet need for family planning from 12.6% in 2014 to 10.6% by 2020, and increase the prevalence rate of contraceptive methods used among women from 85.5% to 62.8% by 2020. President Sisi initiatives to support women's health entitled 1 Million of Health by Ministry of Health and Population. Family planning sector has launched a family planning refresher campaigns entitled Your Right to Plan for Family in Governorates of Egypt. Family planning sector, MOH, conducted multiple seminars and orientation meetings about the benefits of family planning, reproductive health, contraceptive use in Upper Egypt and Sinai. President Sisi is rolling out a campaign of 2 children is enough. Ministry of Social Solidarity launched an aggressive 2-year project called in Arabic 2 Kifaya. 2 Kifaya, it means 2 is enough. 2 Kifaya also seeks to provide free birth control to families and coupling with 100 local NGOs, which will develop family planning clinics in Egypt's highest governorates with the highest birth rates. Project Kifaya as a comprehensive media campaign through the spreading of pro-family and family planning message on billboards in media. Project will be working with over 1 million women in the hopes of stabilizing birth rates. The project also is in collaboration between Ministry and Takaful, the program which provides access to jobs, illiteracy courses, income support to poor households with the children younger than 18. This is finally when I told you the in-kind contribution of any ministry. I developed an assessment for each ministry, okay, to give us a benefit for the lady who had 2 educated children. Per se, for Ministry of Education, that they can provide an acceptance in universities with discount or free learning tuition. Ministry of Transportation, they can give a medal for the women who have 2 educated children. Ministry of Agriculture can give a land of a Fidan to youth to be paid and installment plan on long period. I did it for 30 ministries, and this is a sample, okay, from the ministries and short. By the end of the paper of each ministry, I wrote maybe between 8 and 10 selections, and if they don't want these, specify what you want to give. Okay? Thank you very much.